So if we take those three questions, like
Yeah.
number one, does my child has autism? What does the latest science say about that, and how to find out, and and to what degree, right? Because autism is a spectrum, right?
Hmm.
it's not a one, one particular thing. What are some of the things that you can share with the audience that you've learned along your career?
Yeah. So I think the biggest thing are just understanding what the criteria are for a diagnosis of autism. So the Diagnostic Statistical Manual, I think we're on our fifth edition now. And like you said, it's that spectrum. So individuals for that diagnosis have to have demonstrate some sort of deficits in social communication, social interaction, and then they also have to demonstrate some sort of restricted or repetitive interest or behaviors. So you might see the classic like hand flapping. You may see kids spinning the wheels or insistent on certain patterns or certain routines. So they have to demonstrate those sort of deficits and excesses in their behavior. And it's usually seen at an early age. So I think it's before age 2 that you will see some of these um, kind of behaviors. And so families can look for some of those early signs. They may not respond to their name early on, may not see that babbling, the eye contact. So parents have reported as early as 1 years old, they're seeing development like just not quite right. They're like other kids have some words and might be looking. Sometimes they're not imitating, so or responding. So little guys, right? They'll look at you and they'll be like, "Mommy, Daddy," and they'll just point. They won't say "Mommy, Dad." They might go, pointing to the airplane or pointing to the pool or whatever. Kids with autism a lot of times aren't doing that early on. So there are a lot of those kind of early signs, not looking at you, not caring if a parent is in the room or not. So there's some things that parents can identify, but again, going back to those core symptoms or core characteristics of autism for that diagnosis, that the deficits in social communication and interaction, and then those restricted and repetitive behaviors.
So is it safe to say that the diagnosis is mainly or strictly uh, done through behavioral observation, or in today's day and age, do we have other types of tests that could be done? Maybe a neurological test, or imaging test, or blood test. Is there anything that can be done through the inside, or are we still in the stage where it's a behavioral observation approach?
Yeah, so right now there is no blood tests or no imaging that we can conduct. It is, like you said, through the observation. So typically, families kind of how they go through the process is parents may say, hey, something's not quite right. They're, interacting with the pediatrician at their well child visits. And the doctors are like, okay, well, asking a series of questions. At 18 and 24 months, there's a mandatory autism screener called the MCHAT that's done for all kids, whether there's a family suspects or the physician suspects autism. So all kids are screened at that point. It's just a lot of times parents will be asked through an iPad, to answer some questions. And if there are some red flags there, then a pediatrician would recommend a referral to a specialist. Parents can also ask for a referral if they're, saying something's not right, development's not right. They maybe just can't pinpoint what it is. They can always ask for a referral for a more in depth assessment. So typically, they would be referred to, a developmental pediatrician, a child psychiatrist, child neurologist to do that assessment for autism. I will say the wait lists are very long for those assessments. So, yeah, it would be great if there was some sort of quick and easy way to identify autism because there just aren't enough providers out there that are trained and specialize in the diagnosis of autism. Um, Also, being able to differentially diagnose. So, when we talk about development, a lot of kids, you know, it may seem like autism, but it could be maybe an intellectual disability, Down syndrome. It could be some other disability or diagnosis that they meet criteria for. Um, so it's a matter of, you know, you need to have those specialized practitioners, physicians that know how to conduct that assessment and make that diagnosis. Um, but yeah, so that's, I will say that a lot of kids, they can be diagnosed as early as 2 years old, but most of them, right now, the average is age 4 that a lot of these kids are being diagnosed. So I think that just speaks to how long it takes for families to, one, access an assessment and that specialized physician. But I think it also speaks to that some families, it takes them some time to come to terms with, you know, something's not quite right, or just maybe accepting that their child does have a diagnosis of autism.
Okay, thank you. What about the second question? Will my child ever speak? What can
Yeah.
you tell us about that?
Yeah. So the best answer I can give is we don't know. And it's probably not the best answer, but I think I get families literally all the time when they come in, like they're like, I want my kid to talk. I need my kid to talk. And the good thing about it is that, you know, your kid may not talk, but there are other modalities of communication. So we can give them a way to communicate their wants and needs, and that's the most important thing. So a lot of the kids that we work with or individuals that we work with, you see a lot of maladaptive or challenging behaviors. Um, for instance, dropping to the floor, hitting themselves in the head, biting others, kicking others. You see a lot of those behaviors happening, and it's because of that lack of communication. If I can't tell you how I'm feeling, or that I want something, I'm thirsty, I'm hungry, I want the toys that are up on the shelf, you can imagine how frustrating that is. And so a lot of these individuals will find a way to communicate, and it may not be the most appropriate, or it's a more maladaptive way, but they get their point across. So our job, right, is to teach them and give them some way to communicate, whether it's through an exchange of a picture, through sign language. There are speech generating devices. Some people use iPads and can communicate that way. Um, but I will say it's kind of funny because like I said, I have families asking me all the time, you know, when is my kid going to talk? Are they going to talk? And you know, I can't say yes or no that your child will talk, but I can say we're going to work on it. And even when you teach some of these other modalities, a lot of times you will see an increase in the vocal behavior when you're doing both. But funny story, I had a couple of families that I've worked with, and the parents will say, I just want my kid to talk, right? And that's their goal, just talk. And then later on we'll start working with them, and the kids will start talking. So this one kid, he would say bus, 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 and that was his first word, right? Was bus. He loved buses. Originally he started, you know, just spinning the wheels of the bus, and then he would see a bus outside and he'd say bus, bus, bus. And then later on the parents came in and they're like, he will not shut up. He just talks and talks and talks. And I tell the parents, like, you can't have it both ways. You can't have where you want your kid to talk or you want them to shut up. And to be honest, that's typical kind of language development, right? But it's a little different when you have an infant or a toddler kind of working through their language versus, you know, you may have like a 5 or 6 year old that is doing the same thing when they're babbling and repeating their sounds and language over and over. It seems a little bit different, but it's still kind of that appropriate kind of development of language. So I always tell parents you can't have it both ways.
Thanks again, Melissa. Hopefully,
Thank you.
this is obviously a topic that we can't cover in 30 minutes. So
Yeah.
there's a lot more that I would want to ask you, but maybe we can have you back in the future and cover some more. I know this is a topic of interest, it's of importance, it's close to my heart as of recent, and would love to be a resource for the audience. And I will ask you for your top place to go for information for for parents or people who want to learn more about autism? Is there a good place that you go to?
Yeah, I really think the Centers for Disease Control is probably your best bet. There's also Autism Speaks that has some information there and some resources. Um, and those are probably my top two. There's some more that I can definitely send your way for families, if they're looking for providers or they're looking for adult services versus early intervention or diagnostic. There's a wealth of information, so I can definitely send those over for your listeners to look into.
Well, great, Melissa. Thank you very much for your time. And then we'll be talking
Yeah,
soon.
sounds good. Thank you for the invitation.